So there is many new techniques that are used in terms of treatment of the spine. This has shortened the recovery time, shortened the time in the hospital, and allowed for much better outcomes with much less blood loss than has been in the past. There are many different ways to approach one spine problem, and there's many different things to think about in terms of what's the right way to treat a patient. And even when you speak about a decompression of a certain portion of the spine or a fusion of a certain portion of the spine, there are many different ways to remedy and treat that problem. So first of all, if we just start from the neck, cervical spine, a very common procedure, which is an anterior cervical discectomy and fusion with plating, which is the standard now. Basically what happens is from the front of the neck, we go in and we open up the space. We take out that compressed disc that might be pushing on the spinal cord or the nerve root, and we place a spacer in there to align the patient and keep and restore that height. It used to be that we were just concerned with placing a spacer there and just holding that space open. But as we have understood with time is that there's a global balance within the spine. The curves that we spoke about between the cervical, thoracic, and lumbar spine must be balanced in order to give good longevity and to decrease the risk of what people call adjacent segment disease, which is disease in the levels above and below the levels of fusion. With advancements in the way that we measure this and the interoperative computer angulation and measurements, we were able to decrease the risk of adjacent segment disease and also improve functional outcomes. So if we review here, this is that same or similar picture of the MRI of the spine. There's a disc herniation at C5, C6. If we saw this, a person could have weakness in his biceps or her biceps, could have pain radiating down the arm in that C6 dermatomal distribution, or could have problems with balance. You can see here that there was a surgery that was performed to address the concerns here. Now, this would be if someone had multiple levels of disease. And what we're not looking at here is all the cross-sectional views. And in this specific patient, there were problems with the nerve roots at the levels above and below. And we had to address all of those stenotic symptoms to treat the patient. You can see here that the curve was restored and that the cervical lordosis was preserved. So this is a pretty busy slide, but it does show multiple different disease pathologies that we've talked about in the past here in an actual cartoon format. So this is a normal disc. So you can see here there's a normal height. The oval, which is called the neuroforamen, is well restored here. And this is an area where you don't see any clear compression. The degenerative disc here is basically a disc that hasn't lost much height, but when you look at it on MRI, there's dehydration, which tells us that it cannot sustain weight and compression as well. And most likely when the patient bears weight, there's a loss of the space where the nerve exits or the neuroforamen, which could cause stenosis. Disc bulging has to do with just a bulging disc without that outer layer of the disc. As we remember, there's an annular layer, the fibrous layer, and the gelatinous layer. And here, in just a bulging disc, there's not actually a tear of that outer layer. A herniated disc is the tear of the outer layer and that gelatinous material going out into the canal, causing inflammation and pressure on the nerve roots. Disc degeneration here shows that there's not only a loss of the disc height, but also there's arthritic component, enlarged joints, and compression from the bone actually compressing on the neural elements. So for these, a person can start with physical therapy, injections, and there can be different operative treatments such as a microdiscectomy, or in some cases, even a spinal fusion.